All right, welcome everyone. I know some people are still joining us, but I'm just going to take a moment to go through a brief little slideshow on some tech support features and that kind of thing. So as you get on, please share your name, your agency, and location. We're using just the chat feature for introductions because with a group this size, it'll take probably half our time to do introductions. So you'll get to chat with each other a little bit more in the small group breakout sessions. So we are recording this session. And if you want to know where all your controls are, look at the bottom of your screen. We've got the chat, we've got a glance of the other participants, mute and unmute. You are muted upon entry, so you will need to unmute yourselves to speak or participate when we do the small groups. And if you do have a webcam, we'd love to see your face, especially with those small group breakout rooms. So if you want to find the rest of the screen and kind of play with the different views that Zoom has available, go ahead and check that out. And if you're having any problems with your audio, let me know and I can help. And I can give you a call-in number so you can join the audio by phone if you haven't already done so. Okay. All right, well, we're just at noon. In the interest of time, we'll get started. I'm going to respond to some messages here and hand it over to David, who's going to introduce the session. So I'm going to go ahead and stop my share here, David.
Thanks, Erin. Welcome, everyone. Good afternoon. We have a very diverse group today. I'm looking forward to a really great discussion. So this is the first of our supervisor learning series for patient navigator supervisors. And these will be monthly. We have 3 sessions set right now. Today, we'll talk about writing patient navigator, job descriptions. Tuesday, April 17th, the topic will be role clarity for navigators. And then Tuesday, May 22nd, we'll have a panel discussion on integrating navigators into the healthcare team. And there'll possibly be more sessions, depending on what we learn from you all in going through these first 3 monthly sessions. So welcome again. My name is David Kay. I'm one of the trainers for the Patient Navigator Training Collaborative, and among the courses that I teach is the Patient Navigator Supervisor course. So in today's session, will be 2 parts. We're going to have a presentation by Ronnie Morales from Mountain Family Health Centers, and I'll introduce her in just a minute. Then after her presentation, we're going to break into smaller groups to do an activity, and I'll give you some detailed instructions on what we want to accomplish during that breakout activity. When we get there, I'll give you more detailed instructions. And then we'll come back together about 10 minutes to 1 to debrief and answer any additional questions. And then at 1 o'clock, we're fortunate to be joined by Dr. Pat Uris from the Colorado Department of Public Health and Environment, who's going to talk and answer questions about the state's examination and registry for patient navigators. And if you are unable to stay for that after 1 o'clock, the session, as Erin pointed out, will be recorded, and you'll be able to watch that at a later date. Okay, couple of housekeeping measures. If you have questions during the presentation, just type them into the chat function there at the bottom of the screen. And we'd like for you to share whatever job descriptions that you have for navigators. One of the benefits of these sessions is networking with other people and learning from other organizations. So if you have job descriptions, Erin has provided a link to post those. And thank you for those who have already done so. And you'll have the opportunity during the session to post a job description if you haven't already done that. Okay, so without further ado, it's my great pleasure to introduce Ronnie Morales for today's presentation. Ronnie is the Social Health Advocate Supervisor at Mountain Family Health Centers in Glenwood Springs, Colorado. And for those of you from outside Colorado joining us today, this is one of our lovely mountain communities west of Denver. Ronnie is a medical assistant who began her career with Mountain Family Health Centers as a patient navigator, and she's also one of the trainers in our Patient Navigator Training Collaborative. So I'll let Ronnie tell you more about herself and her role at Mountain Family Health Centers. Ronnie?
Thank you, David. Thank you so much for having me here today, and good afternoon to everyone, and thank you so much for joining us. Like David said, my name is Ronnie Morales, and I'm the Social Health Advocate Supervisor for Mountain Family Health Centers. I've been with them for, I want to say, 8 years now, and I started off my career with them as a medical assistant on the floor with other providers and the rest of the care team, and then I joined the ranks as a patient navigator and started off as a participant with the Patient Navigator Training Collaborative as of, I want to say, 2013. And have now, not only have I been a participant, but now I'm a trainer facilitator for them as well. At the moment, I work in the care coordination department along with behavioral health. And I was part of that, the development of that department, because my department's fairly new, about probably 4 years old. And also, the role with the patient navigator has totally evolved within our organization. And so I'm really excited to talk about job descriptions, because I find that job descriptions are forever evolving, especially in our field, as definitely, you know, we go through all these changes and we have to adapt to what comes our way, not only for the population that we serve, but a lot of the times to certain contracts or grants or funding that comes our way. So today, when we talk about job descriptions, I wanted to share a couple of the job descriptions on how it started with the Patient Navigator program at the time back in 2013 and what it has evolved to today. So we wanted to, I know that David talked about recognizing the important components of the Patient Navigator job description, and you all have had a chance to go over the competencies of what the Patient Navigator basics are. And when I read through them again one more time, just to kind of make a reference with the job descriptions, it really, you know, the term patient navigator, I think, can be so broad, and there definitely can be a lot of questions about, you know, licensed, non-licensed, and how that all comes together depending on your organizational needs. So I am really hoping that with today's presentation, one of the key components that you guys will be able to take away is, do your current job descriptions now, are they serving your needs? Why or why not? Back in 2013, when I first started off as a patient navigator, it was through a grant for the Colorado Prevention Center, and it was mainly to manage at-risk or high-risk cardiovascular disease and diabetes. And so the really awesome thing about this program is that I only focus on the management of this for the health outcomes of these populations, and really make sure that, of course, eliminating barriers, but really bringing access to those folks who had no access due to the fact that they didn't have medical insurance. With that being said, after funding went away for that particular position, we definitely wanted to adopt the patient navigator concept, wanted to adopt the patient navigator role and bring it into the care coordination department, keeping the focus, yes, on health education, but also adding the added duties of how to really wrap around services around our patients and how to eliminate barriers when it came to the social determinants of health. And so I wanted to share those two job descriptions so that you guys could see kind of how we started and where we're at now, just based on all the different things that we've had to do in order to have our job descriptions match the different roles that we have in our department. So, Erin, did you want me to share my screen, or did you have those documents pulled up?
You can go ahead and have control and share, and that way you can you can drive.
Thank you. Okay, guys. So the biggest thing I think when it comes to job descriptions is definitely, there we go. Is that my patient navigator? Yes. Let me just, oh, okay, cool. So when it comes to job descriptions, there's definitely, you know, the big topic of job description versus competencies and how do we kind of merge all of that together. And, you know, one of the things that we do, and I ask my HR department, is how do we even begin to develop our job descriptions? A lot of our HR have already templates. You know, one of the biggest things that I get is, you know, we just kind of get our job descriptions handed down to us because, you know, that's what we have. And sometimes the biggest thing is that they're outdated. So first and foremost is, does your HR have a vault of job descriptions? And I talk to my HR people to ask them, you know, how do we go on about particularly our job descriptions? And we do have a vault. However, when we have grants and fundings come on board, a lot of the times, some of these job descriptions are provided for us. If we are hiring for a completely new role to kind of make you know, because we're building up or we're developing a new department, we definitely reach out to the Colorado Community Health Center Network and also the NAC, which is the NAHC. And we reach out to them to see, hey, you know, where we just got this grant, and these are some of the roles we need to have within for this grant. And so they go ahead and provide us. We also do a lot of networking with job descriptions with all of our other outside agencies to kind of cross-reference, you know, a lot of the similarities among just different roles within our community. The biggest thing about having a template, though, is that it really helps communicate the demographics, the purpose, the essential functions, and the job specifications. And it really makes you know, it really helps streamline if your organization is in the middle of developing different roles. There's also, I think, you know, within my organization, I can speak from experience that we have come a long way as far as job descriptions go. And so it's really nice that now whenever, because of this best practice, that now whenever we have a new role opening up or we're about to develop something new, we already have kind of like a toolkit to go to. The other thing is, a lot of the times these job descriptions, when you're making edits so that it makes sure that it's really streamlining to what you have as far as deliverables on a contract for a grant, a lot of the wording can be taken out specifically from those contracts. So in the beginning, again, the patient navigator role in Mountain Family Health Center was really towards that population for disease management. And it continues to be a free service, but definitely making sure that we were screening, we were reaching out, we were doing coaching and connection back to the primary healthcare provider, and making sure that we were able to measure those that improvement in the health outcomes. As we started creating the Department of Care Coordination, all of the, for example, all of the patient navigators in my department are medical assistants. So that was a learning curve for us, because in the past we had hired staff members who didn't have, for example, an MA background, but they brought, you know, other strengths to the team. And I can speak on personal experience from those staff members that they did an amazing job as far as fulfilling the role, but they definitely had more challenges than someone coming in with a medical assistant background. Where I work, it's a primary healthcare setting, and so we are definitely integrated within the clinical care teams. And we are very much a part of that clinical role on the floor. And so having a medical assistant is something that we identified early on as being an essential requirement for this position, as we said, okay, so we have the health education portion down as far as that part of that patient navigation. How do we make this role a little bit more multifaceted, and really have these patient navigators start doing things to support the care coordination department, and also have more of a wraparound for these patients that we're serving. And so that's when, and we've gone through so many title changes, At the end of the day, I really feel that we're all patient navigators and patient advocates at heart. But it really, the title changes. It's really more to fulfill these contracts or these grants that we have. And so going back to this particular, what I love about the job description, the way it's all put together, is it really, and it's really nice to kind of see the comparison of how we started and where we're at now. So just, you know, some of the communication stuff, your clinical care duties, just really breaking it down. And then at the very bottom, we have things that are what I like to call some of the job, like the general stuff as far as things that have to do with your customer service skills, your professionalism, your miscellaneous items, anything having that make sure that our requirements for HR, maybe it's for OSHA, maybe it's for HIPAA, all of that being included. Let's see. Again, this is the same job description, but this is more for a patient educator. And this is where we started just getting a little bit more organized and streamlined about, like, okay, what other things have we identified that comes up during our patient navigation for health education that we do or that we conduct or that we provide that hasn't been, hasn't been put into writing. And so just as clearly as we made changes into our department and just seeing the different needs, also the biggest thing is having non-licensed staff work alongside licensed staff, and then how can we best make a genuine collaboration between both teams and really work cohesively, but also how can we be best support for those licensed people so that all of us are working at the top of our scope. And the next job description is the social health advocate / MA. As you can see, I think one of the biggest things here to point out when writing a job description is a purpose statement. I think for the first time, normally we relied a lot on our contracts. We kind of had our job description kind of attach it to that grant. Where now it's like we're really making sure that these job descriptions are very explicit as far as, you know, making sure that we have, we're just best practice. How do we make up that purpose statement, right? And so that if someone's looking at that job description, or maybe it's being proposed to admin, you know, having that statements to really, why does the position exist? Why do we need this position within our department or for our organization? It's also, this is a portion where you would put anything that has to apply. Like, is this a particular position that is applying to a grant, a contract? This is like the part where we definitely will be specifying that. Essential duties and responsibilities, again with the communication portion. This is where our roles have really come a long way. So again, patient navigation for health education, and just how it has now evolved to be able to provide care coordination and even case management, and even be assigned certain panels of number of patients for our panel. So this really breaks it down as far as like what are those essential functions or what are those essential duties that are listed, and are they in a chronological order, like are they in the order of importance? Making sure that we really break it down for people to really understand what their job really entails. These job descriptions are also, as I was telling David and Aaron, are posted when we are recruiting for new hires. And our job descriptions really help us with the interviewing process as well. Definitely having someone take a look ahead of time and just really giving us kind of like their feedback as far as questions that are specific to this job description, like have they ever even worked with managing populations for certain disease management. Again, you will see some portions on here that talks to our specific contract. The biggest thing about our social health advocates is not just providing health education and, again, going along with the sides of care coordination and case management, but also transitions of care, again, for social determinants of health. And then this is the portion where we said, okay, so they're doing all of this other support stuff for care coordination. what are their clinical duties when they are on the floor as an MA. Now, at the time right now, we have this portion because we do have one particular provider for our care coordination department. And so therefore, when she's seeing patients, we have one of our social health advocates that's assigned to them as a medical assistant. So then we want to go ahead and add this portion. If it's someone on my team that doesn't do this portion completely gets taken out. Or sometimes we even put on here like, as needed, or, per the care coordination director, just to make sure that we have it on there. And then again, with the stuff that's supposed to be on here as far as HR, OSHA, and your general employee responsibilities. Okay. The other great thing about having really streamlined job descriptions, so one of the things that came out of having this was a checklist. And this comes in very, very handy, especially when you're doing new hire orientation. In my organization, we do new hire orientation. People are training for 6 to 8 weeks, depending on the role. And then we go ahead and put them on the floor to start, their first 30 days because we do a 90-day evaluation. And one of these particular tools that we use is based on your job description. We outline it into an Excel spreadsheet to have a go-to as far as checking people off on skills and competencies per their job description, having them sign. And again, all of these things that I'm showing you today are definitely things that have been learning experiences through challenges and successes. This came in really handy when we're having our staff members just talk about how after being a certain time on the floor, having challenges because they didn't get trained a certain way, or maybe they didn't learn a certain part of their job. And so this really helps employees or staff members be a little bit more proactive about voicing their needs in a timely manner, but also allows us supervisors to identify some of the challenges and also identify how we can best support our staff members and do it sooner rather than later. And so all of these checklists, and I'm just going to move this real quick, gets signed and acknowledged at the very bottom. And I use it not only for a 90-day review, but also sometimes, when I do one-on-one coachings with staff members, sometimes this also comes in very handy if I ever have to do a performance improvement plan. It gives it's very specific to what it is that the staff member is needing or what they're having a challenge with. But I feel that it really empowers a staff member to take some accountability as far as being explicit on their request on why they feel that they're not successful in their role, or they're having some challenges that they would like some support on. It also is a really great tool to play to people's strengths and seeing and really evaluating their position on our team as far as, is this a good fit? How can we best support? What other areas have we not identified that this person might need ongoing support, or is there something else that needs to be done? And then also having that employee take some accountability on their behalf as far as saying, okay, here's some of the support that I've been granted. What else can I do? Or what am I not asked? What else haven't I asked for? Do we have any questions so far, David? Are we good?
Yeah, but now's a great time. If anyone has any questions, you can either type it in or feel free to mute yourself if you have anything that you'd like to address right now.
Well, while folks are doing that, Ronnie, just to clarify, that checklist is a list of the duty statements taken right out of the job description, so you can isolate people's strengths and areas for improvement to be more precise. And it's interesting because you're tailoring your support for the navigators just like we're trying to tailor our support for the patients.
That is correct, David. Definitely, like I said, we bring it right off the job description, and it's also, when I think about because I'm also the one that puts the trainings together and all of that, like it really also helps me, because what if it's more than one person particularly struggling with a particular duty on that job description? Is it something that needs to be looked at a little bit further, or is it just this one individual who is for the first time really being exposed to this particular duty, and they've never had, and they just need more support? But I think from a staff member's point of view, sometimes it can be difficult to ask for help, but this really helps them be specific about what it is that they're struggling, because maybe they're shining in every other area, but there are maybe specific things of their duties. Or I think the biggest thing is like when people don't have a clear understanding on how their role might impact that not only the team, but maybe like a particular deliverable on a grant or something like that. And so this really helps people kind of have an idea of what they're bringing to the team, what their role and how it impacts not just the team, but maybe the bigger picture. And also it's a really great tool for people to be specific about their needs.
Okay, great, thanks. So the first question was, would it be possible to get a copy of this checklist? And Aaron responded, yes, the resources will be shared. And then the next question comes from Jill Schneider. I came a bit late. Ronnie, where are you from? And tell us a little bit about your population so that you had it.
Of course. So I work for Mountain Family Health Centers in Glenwood Springs. And Mountain Family Health Centers is a nonprofit community healthcare organization. In the beginning, the patient navigator position in my organization was only targeted to the at-risk or the high-risk populations of cardiovascular disease and diabetes for management and ongoing support. And so the medical assistants that were patient navigators, that's all we did, and we did it in collaboration with the Colorado Prevention Center. That was over 5 years ago. As of today, in my department for care coordination, we are contracted through Rocky Mountain Health Plan. So that means that we support the population that has Medicaid, Medicare, and Medicaid Prime. We do care coordination and case management services as well as transitions of care. However, because all of us are at the core, patient navigators, medical assistants, we're able to really collaborate with our nurses on our team and really bridge the gap for care coordination and case management. And we do it for the population that's the most vulnerable in our communities that are at risk for sentinel events or deterioration of health and reducing the cost per capita of healthcare. So that's what we do now, but because of the patient navigation fundamentals, we have adopted the patient education portion, brought it on board, made it a permanent fixture in our department, because one of the biggest takeaways from that program was being able to provide access to folks who are at risk or at high risk of cardiovascular disease and diabetes to have access to someone that's doing their coaching for healthy lifestyle changes. Because a lot of the times our patients, if they need a dietitian, a nutritionist, if you have Medicaid, you can have access to that. But if you don't, where do you go? And so Mountain Family provides that ongoing support at no cost for adult patients. And it's it's an ongoing thing. And then right now in my department, even though we are limited by that payer source, our goal is to be able to provide these services of navigating everyone through the complex healthcare system for all of our patients.
Great. Thanks, Ronnie. So our next question comes from Maria Casaverde. Do you track specific metrics related to how the patient navigator work has helped to improve quality metrics? What's your patient navigator panel size?
Yes, absolutely. So from the patient navigators that are solely doing patient health education, they have to manage 200 patients a year. And they have to have, for example, 20 phone calls per week. The biggest thing that we collaborate with our quality improvement department is a lot of our patients clearly are going to overlap on registries, whether that is they're on the high risk diabetes, high risk cardiovascular, but also we have risk stratification tools, as far as like, are they on X amount of meds and things like that. So again, going back to the job description and the role clarity, it is really important for us to make sure that everyone on our team is working at our highest, at the highest of our scope. How do we best support? We do have nurses. However, what can be done by a non-licensed staff member to best support our nurses and manage these populations? So the patient navigators are going to manage those patients that are really struggling with disease management, but they're not necessarily struggling with majority things of like social health determinants like housing, transportation, income. That's the next level of care, the higher acuity. And so, but again, we're helping our care teams, our nurses, providers, our other medical assistants, dental team, behavioral health team, in collaboration with our QI department, because we make sure that every patient that's going to be doing health education is targeted through our UDS measure registries.
Thanks, Ronnie. I don't see any more questions, but I have one. So one of the challenges of job descriptions is to guard against scope creep. In other words, the job has actually become something different than what's in the job description. How often do you review these descriptions to make sure that they're still in alignment with what the job actually is doing or should be doing?
That's a great question. We actually have a DRC, which is a document review committee, where someone like a lead or a champion from each department takes part of this. This committee is constantly reviewing things like standing orders for our medical assistants, to providers, to nurses, policies and procedures. And then another big one is job descriptions. In my department, because it's so fairly new and we have so many grants and stuff like that, we have to review our job descriptions every 12 months. But that really depends on the department, and it really, I feel like, we do this in collaboration with HR, which is amazing. I think our HR department has come such a long way in the past 8 years. And so now we really have, again, a streamlined process on how we do things. And so it's really nice to know that we have eyes on these documents before they make it to the table. But we, the people, mid-managers, directors, we're constantly on top of this, because I feel like we're just making more space for more staff members to come in. And then also we want to make sure that all of our job descriptions truly align with the things that are on our deliverables.
Thanks, Ronnie. Okay, I think it's, I don't see any additional questions. Oh, here's a new one from Denise Campbell. How do you ensure that the patient navigators stay within their scope?
Great question. So one of the cool things about being a patient navigator and having the opportunity to go to the Patient Navigator Training Collaborative courses is it really gives you the fundamentals to come back to your organization and start setting up or develop or creating what that job description or maybe that role needs to look like, and also have an idea on how you're even going to start implementing, maybe creating buy-in, all of that. However, one of the big things that we talk about when taking these courses, or attending any course for that matter, and I feel like I preach this a lot, is biggest thing as a medical assistant, if you weren't prescribing meds before, are you going to start doing it now? The answer is no, right? So how do we, it's one thing to attend courses, but how do you yourself bring this back to your organization and make sure that you are within your boundaries, that you are following the guidelines? A lot of it comes from your support, your supervisor. Does your supervisor understand what you do or what you're supposed to be doing? I know that a lot of us that do outreach work, we wear many, many hats. However, it is very important to make sure that your job description really supports what you're doing, that you have it in writing, and then what kind of support does your organization have for you? Is it clear? I think one of the biggest things, David, that comes up is like for patient navigators is knowing when it's like after a patient requests a certain service or you see a certain need, when does my role end and it's time for me to hand it over to maybe, for example, a behavioral health colleague to take lead on it. Maybe it's my nurse to take lead on it. For example, I don't do triage. I'm not a nurse, but I have my nurse right there with me who is there to support me as needed. I'm still able to do my job. I'm still able to do my case management, care coordination, but I have my nurse for that higher level. And so I think it's really important as supervisors to really have a clear understanding of the job descriptions, who we have on our team on board, and ask these questions. Or maybe what I do a lot when I do my training sessions with my staff members is I do a lot of role playing. Maybe I present some certain scenarios, but really having that clear communication and transparency of this is your role, and if a scenario like X, Y, and Z was to present itself, these are the next steps that you take.
Okay, thanks. Okay, I think it's time for us to move into our activity. And if you have additional questions, please add them to chat, and we'll try to get them answered before the end of the session. But in any event, the answers will be posted along with the recording. So in the breakout we're about to do, in a moment, Erin's going to transition you into small groups. And then Ronnie and I will be moving among the small groups to monitor and facilitate and see if we can answer any questions. Again, post your questions in the chat. The activity instructions I'm about to give you will be posted in chat in case what I'm about to say is not clear. They'll be written there for you to see on the screen. And of course, if you get stuck at any point, post a question, or you can always return to the big room, as they say. So take a look at your watch. We'll bring you back in about 15 minutes for a debrief with the larger group. So here's what we'd like you to do. So first of all, provide a little background to the people in your small group. Briefly share with the group the population served by your organization and the role of the navigators in the organization. And then let's facilitate some networking here. Based on your review of your job description and what you've learned today, discuss what questions you have and what, if anything, you want to change in your navigator job descriptions or the supervision that you do. So talk about what you think might need to be changed to align these descriptions with what people actually are doing or should be doing. And then do an action plan, just like we ask our patients and clients to do. Plan what are the next steps for any necessary changes or further research or networking that you need to do. What do you want to know, and who do you need to talk to get that information? And if you don't currently use a navigator, you're contemplating adding one, what do you need to research? Who do you need to network with to get started based on what you've heard today? Okay, so Erin, I'll turn it over to you to break us into small groups here.
Sounds good. So I just sent the instructions. They'll be in your chat. You can reference those, but we just want a space for you guys to learn a little bit about each other's work and share kind of tips and tricks. So I'm going to send you all into these virtual breakout rooms. You'll have to there will be a pop-up window, and you'll be able to say, yes, I want to go into the breakout room. So just click that. Couple housekeeping, you are muted, so you'll need to unmute so you can participate. And if you are having trouble, you can exit the breakout room and come back to this main room, and I can see if I can help you. If you are joining just by phone, I don't think there's many, but if you are, it's *6 to mute and unmute. So with that, here we go. So I know there were some audio issues, and I'm happy to work with anyone next time to ensure that you can fully participate. Sometimes in the breakout rooms, it gets tricky. All right. Ronnie, you're back. Is David back? Yep.
I'm here. Yes.
Yep.
Okay.
All right.
Any specific questions that people have that we didn't already address that came up in your breakouts? What do you want to know more about?
Oh, here's one question, David.
Alana? there's a question from Alana. We were wondering if there's a salary list for the positions.
Oh, that's a good question. Now, the PNTC, we can share some data from a survey that we recently did of participants about salary data. As far as a list, I think it would be, it's unique to the position if it has a range for the ones that were included that people are sharing. Ronnie, can you share like a range of salary that you typically hire people in on?
Absolutely, and I can also follow up with that because again, basically depending on the level entry, it definitely ranges, but we definitely start at 16, and it really depends on the level entry of that particular staff member, and it also is going to really be specific to that job description as far as responsibilities and duties. But I can follow up with HR so that you guys get a really good target range. The other thing that I know that HR does is they definitely check what's on the market as well, so that we are matching our staff members with their salaries. So I can follow up with that.
Thank you, Ronnie. And I think it will vary regionally too, throughout Colorado and throughout the country. So yeah, we'll look into that and hopefully provide some further resources. And there's a question about checking in with others as we go about thinking about our action plan. Yeah, I'm glad the breakout was helpful. So I am happy to distribute a contact list with like names and emails. So I will give people an opportunity to opt out. Either if you want to shoot me an email, I sent all the reminder emails so you can reply to that, or just send me a private message now, say, hey, I'd rather not be on that list. That's totally cool. Otherwise, I will go ahead and put that together and send it to the group, because we want you to continue these conversations and networking and that kind of thing.
Okay, and then Kirsten, I think, asked a question, curious about making exempt, non-exempt. Curious about who these folks should report to: quality improvement nurse, clinic manager, etc.
So in my organization, we have a director of integrated care, and she oversees the care coordination department and the behavioral health provider department, and she is a nurse. I'm again social health advocate supervisor, so I oversee all the non-licensed staff. And then I have my colleague who is a nurse, and she's the supervisor and oversees the complex care nurses. And so that's how the reporting goes. However, I have seen it where normally, again, it goes back to QI has their own director, even though behavioral health has the behavioral health lead supervisor that oversees. So it's really, I have also been under the supervision of a nurse before, and that has worked out really great. One of the things that I didn't mention about leadership and mentorship and all of this for patient navigators, because it was brought up again about licensed versus non-licensed. I think having a very clear expectation, having it in writing, how does the organization support these roles? Where can non-licensed staff get the support that they need? But our nurses really stepping up, and our licensed professionals to kind of also do some mentorship. And there's constant trainings for improvement of workflows and flow charts. But a lot of this comes all hand in hand with collaboration of our nurses. So us presenting how we're coaching and how we engage with patients, and then having them kind of also have an overview on like the health parameters that we're teaching on, so that they know that when we're out there, everything is within our scope of work, and vice versa. I think that's really important to make sure that we have that transparency and good communication to have a better collaboration amongst each other. And trust, big trust on that.
Okay, our time is up. I don't see any new questions. And that last question was from Karen Nielsen. My apologies for butchering your name there. I thought it was someone else. Okay, so again, this is recorded, and anybody who had to leave, you can watch what you missed on the recording. And so now I'd like to turn it over to Pat Uris from the Colorado Department of Public Health and Environment to talk about the competency exam for patient navigators and the registry that goes along with it. Pat, can we unmute Pat? And let me just say thank you, Ronnie, very much for a wonderful presentation. It was very informative.
Let's see, Pat, do you hear us? It says you're just joined by video. I don't have a mute or unmute. Well, we might have to, okay. Pat, do you want to call in by phone then so we can hear you? And I can give you that call-in information, because right now I don't think that, let's see. I'm gonna have to go in that phone information for everyone. So if you continue to have questions, yeah, type them in the chat and we can address them as email or anything like that. Okay. Oh, Pat, what's your phone number that you're calling in from? I might need to unmute you by the phone. Or if you hit *6, you can be able to unmute yourself.
While we're waiting, Maria says this on the salary range question, if you're a federally qualified health center, Colorado Community Health Network, is that right? CCHN collects salary ranges for different positions for FQHCs in Colorado. They share this information with all staff from community health clinics, from CHCs. Did I get that right, Maria?
Oh, that's a great resource. Yeah, CCHN, thank you.
Yes.
Thank you for that. That's very helpful.
All right, well, while we're waiting, Pat, I'm sorry we can't hear you right now. I'm trying to even send you a message and it says you're not in the meeting.
She says she can hear us. She's on the phone and she's unmuted.
Yeah. Well, we may have to reschedule this, guys. But just for a quick overview, the State Health Department has an effort. So that's in Colorado. The Colorado Department of Public Health and Environment has an effort to create a health navigator. They're using the term health navigator to kind of encompass the navigation role. So if you're a care coordinator or, kind of that person who this is just for unlicensed navigation professionals, and it would be a statewide registry that's voluntary, and it would be a effort for or a way for employers to ensure that the people that they are hiring have met certain competencies.
Erin, Pat says she re-entered using the computer, not the phone. Can you unmute her?
Yes. Okay, Pat, you are unmuted.
Can you hear me now?
Yes, yay. You're here. We got it. All right.
So weird. And thank you, Ronnie, and thank you, David. I've been listening to the whole thing, and somebody else was on the screen compared to who was talking. So I don't know what happened, but I'm here. And you just did a very nice summary. Thank you.
Sure.
Yeah.
Well, I will turn it over to you. And if people have questions as we go along, just shoot them in the chat, and we'll.
Okay, that'd be great. So everything is live now on our website, and the easiest way to get to it is just Google CDPHE Health Navigator, and it usually comes up. So it's within the health department on a website that says Health Navigator. So the registry is there. That registry will show the public three things. It'll show them the name of the navigators who have completed the competency assessment, the training programs that are recognized by CDPHE, and there's a section for who's offering the assessment, because we were thinking way ahead, but at this time, CAPE at Anschutz is the only contract we have to offer the assessment through October of 2019, and they will offer 8 assessments during that period. One of them will be in a rural area. They're going to try that out because we know it's difficult for people to have to come in for the assessment. We have also spoken with some foundations in town, and they're looking at how they might help for rural areas, so that's something we're working on as well. The cost of the assessment is $363. CDPHE is subsidizing some of that cost until the end of 2019. The first assessment is going to be offered June 2nd. And the reality is only 16 people take the assessment at each offering of the assessment. So then the next assessment is going to be in August, but I don't have the exact date. And then there will be one in October. And the reason I'm talking about the assessments is because we did come up with grandfathering clauses for individuals, 2 types of them. Either they graduated from, or they took level 1 at PNTC in the last 3 years. I think it's since 2015, maybe even earlier. And then the Otero program, if they completed that program. Then there's another grandfathering clause that says if you have 2,000 hours in the past 5 years, and these forms are all on the website, everything is there, you also can just take the assessment and not have to go to a CDPHE recognized training program, of which nobody submitted that information yet, because that was just released. So that's what we anticipate most people will be using probably for the next 12 months is the waiver process. So as part of that experience process, it really is short. It lists, you just have to identify where you've been working, and your supervisors confirm that you've worked that many hours. You may have to go to several of them, or many people may just have one. And then the supervisor just signs that he or she believes that you have the competencies, because we don't want people to take the competency assessment and then not pass. The goal is to have everybody pass. There is a description, and it is very different. I know nobody's put together an assessment like this, although nursing has talked about it, medicine talks about it. So it's a competency-based assessment. And at Anschutz, they have patient actors, standardized patient actors. They have all been trained to a skit. And some of you I know may have helped us pilot the skits. And so you go from room to room, and there's a different scenario on each door, and you're given information about whether it's the first time you've ever met the patient, or you've known the patient for a long time. And they are really, in their competency assessment, focusing on competencies related to care coordination, boundaries, communicating with the patient and the team, and care. Did I say care coordination already? Yeah. So, and then that's what they're really focusing on. And we hope to put on the website a clip from one of the the pilot test, because we don't want people to be afraid of this. That's why we're calling it an assessment. I have test anxiety, so I don't allow the words test or exam. So we understand that. And also, CAPE, and when we were testing it, understand that the first couple of scenarios, people are very nervous, and so they take that into consideration. So then if you take that assessment, it's actually CAPE that will send the name of the individual who has completed it over to the health department, and then it will be entered in the registry. And so that registry is public. And the idea of putting up navigators' names, and it's the name and the zip code, and that's all the employers wanted. We had some really fancy ideas. And what it's telling employers is the individuals on there ought to have these competencies, and it's all the competencies that are listed in our program and on the website. So I'm done talking. Did that make any sense?
That was great, Pat. Thank you.
Okay.
David, do you want to go over your question?
Yeah, thanks, Pat. It makes sense to me, but I've read the documentation on the website, and so I would encourage everyone, if you haven't already done that, to read that information about the registry on the website. And we provided the links. Actually, the one I provided is a general link. Maria, thank you for providing the more specific one to the registry. So, Pat, what does it cost to register if I'm grandfathered, if anything? What does it cost to take the assessment? And can my organization pay those fees for me?
So CAPE is handling all the registration. The health department's not involved. The cost is $363. There is no cost for getting on the registry. That's we've simplified it so much that there's no cost involved. And there's no cost involved for a training program to get recognized as a CDPHE program.
And can my organization pay for me, or do I have to pay for
You know,
that?
we've talked to organizations, and some of them are saying, we are going to make sure all our navigators are on the registry, and yes, that's no big deal. But there are large organizations that have said something like that.
Okay.
So smaller organizations may not take the same approach.
Okay.
But the advisory committees and key partner, I mean, you can see who was on all of those on the website too. And they really felt that everybody needed to have skin in the game, is what they called it. That the navigator probably should pay a portion, the employer should pay a portion. We have worked with the recognition of the training programs to require that they get on the list for WIOA funding, and that's a federal program that passes money down for new workforce or people entering the workforce who are particularly from underserved areas. And that may be able to pay for the assessment if the training programs build that into their fees, if they build the assessment into their fees.
Is that federal funding through the Colorado Department of Labor and Employment?
Yeah, they're called the Colorado Workforce Development Council.
Okay.
And then in each of where everybody lives, there's a Workforce Development Council, and you actually have to go to them and ask them to help pay for your training. And PNTC, as well as the community colleges or boomers, we really double check that money can go through training programs, and you don't have to be in a college. I do want to say right now that our registry is for unlicensed navigators only.
Right.
Because we feel that nurses are practicing nursing, social workers are practicing social work, and they're regulated by the Department of Regulatory Agencies. And we really are talking about people who are from the community and often have a GED. So, I mean, that's what we're thinking.
Yeah. And so we have a question from Maria. Let's see. Wait, there was one from Denise. Do the training programs need to be in the state of Colorado?
Yes, they do.
Okay.
Yeah, that was a hard one for the group, but states like Ohio and Minnesota and all of them who do this with CHW said it was just impossible to be outside of the state yet. It's not developed as well as like nursing and medicine. So that's why.
Okay, thanks. And then Maria asks, if the Navigator fails the assessment, will they need to pay a new registration fee to take it again?
Yes, you do. That's why we don't want people to fail. And and supervisors, especially, you know, the ones who have been working for a while, that they take seriously that the navigators, they believe, have those competencies. Because we don't want to send people there to fail.
Sure.
And then there's, on the CAPE registration site, they give you information on, you know, if there's a no-show, which we saw during the pilot a lot, you're going to end up having to pay that fee. But they give cutoff dates for getting a portion of the fee back. So all the registration information, we have a link to it, is at Anschutz on CAPE's website, and they handle all of it.
And the CAPE stands for?
Oh, please.
Aaron?
I
Aaron?
think I know. Center for Academic and Performance Excellence.
Oh, yes. Thank you.
Okay.
And they use it with nursing. They use it with medicine. The students going through this exact same thing, but they're the first in the country to try to do competency for health navigators.
Okay. And there's a link to CAPE, you said, on your website.
Yes.
Great.
Yeah. It says register here, and then it shoots you over there or something.
Perfect. Okay. I see no other questions waiting in the queue on the chat.
All right.
Last call. All right. Seeing none, that concludes our presentation. Pat, is there any final remarks, Pat?
No, I'm fine. We're over time, so it's been a delight to participate.
Oh, thank you. We appreciate you taking time to do this. Once again, thank you, everyone. Ronnie, thank you for a great presentation. I hope you all found it helpful. Don't forget to let Aaron know. Aaron, do you want them to opt into the distribution list or opt out of it?
I think just opt out.
Okay.
Yeah, I think a majority of people would like to be included, and it'll just be name, organization, and email. I won't include phone numbers. So, yep, and then I can send that out via email.
Okay, great. All right, that concludes today's session. The next one is April 17th, Tuesday, April 17th at noon, and that's on Patient Navigator Role Clarity. All right.
Great. Thank you all. Have a wonderful rest of your day.
Thanks.